morning, everybody. Um, I I think you know me. Yeah. So let's start with the topics that we are going to discuss today. Training the modern surgeon how to teach psychomotor in modern era. Yeah. Okay. So I'm Dr. C here, consultant breast surgeon, Department of Surgery. So this is my outline. First, I will do an introduction, and after that, we will explain what is the psychomotor skill, yeah, from theory to practical, and then we will go on for train psychomotor skill for surgeon, and we will move on to modern era training, and the last part will be complete conclusion. So what we know is psychomotor skill is the skill requiring the use of coordination of our skeletal muscle as in the physical activity of performing, manipulating and constructing a skill. Okay, all right, a task. So what is psychomotor skill in theory to practical? So what is skill? Skill is defined as a very stable, reliable link between our perception of the body and environment and execution of the goal-directed motor action, which is both consistent across repeated performances of the action, and it can be flexible, adapted to change in task constraint. So what we call it is perceptual motor function. So this is what we said, psycho add-on motor. Okay, our brain and our mind coordination with our hand. Okay, so psychomotor skill actually is the learning is demonstrated by physical skills such as movement, coordination, manipulation, dexterity, grace, strength, speed, and it can be demonstrated to the fine motor skills such as the use of precision instrument or tools like what we do as during surgery. So the ability refer to a wide range of action involve physical movement related to the conscious cognitive processing. So psychomotor ability actually is a measure of the accuracy or the speed. So psychomotor skill, it is a skill where movement and thinking are combined together, and this includes things that like balance and coordination, and then during laparoscopic surgery or that. So the learning is demonstrated by our physical skills such as all the movement as well as the speeds which is demonstrated in the fine motor precision of the instrument. There's two category of psychomotor skill, which is discrete skill and continuous skill. So discrete skill is that consists of a single step or a few step and have a very distinct. It is a very um, it will it become a block like that. It won't be a continuous what where where else the continuous type of skill is the beginning and the ending point, they are related, yeah, and it will train our performer and is very determined. So is our actually our surgical skill is a type of psychomotor skill, yeah. So when we do surgery or what we call during performing a surgery, it requires a lot of capacity in a lot of behavior, okay. So it needs a lot of coordination, yeah? It needs skill behavior such as visual, haptic perception, our perception through touching, fine grain physical and temporal movement between our brain and as well as our fine finger movement. We manipulate the tools and awareness of the overall skill at hand through integrating elements. Yeah. So this is a domain of our psychomotor skill, which is agility, endurance, the strength, precision, flexibility, as well as speed that just now I explained to you. Yeah. Okay, so this is Adam's psychomotor feedback loop. Yeah, so we will start with knowledge, our sensory input first. Yeah, okay, and then it move on to knowledge of result, and our skill will be adapted during the whole loop, and this is a feedback whether the skill is improved or the skill is the early phase of the our skill or the improvement of our skill. So this is a stages of psychomotor skills. We call, what stage is this? Yeah. So we start with stages. What is being learned? Okay. And then after that, how easy is knowledge retrieved? Okay. And how good is performance? This is the three stages. Yeah. Then we move on to cognitive, verbal information, procedure rules. So when we start with thinking of a skill, so we need to start with a cognitive. So our brain, we have to set up a system that we have to understand how is the procedure being done, before we even touch the instrument, even before we perform the surgical skill. Then after that, we have to understand initial error. When we start doing the skill, we do have error, and all the error we will slowly correct it, and the psychomotor connection will be formed, and the understanding of the procedure rules. And then furthermore, we will become autonomous. Yeah, if we become reflex to our movement, and it can be more fine tuning. Yeah. So for the first part, we have to understand it's more labor intensive, and it will be a very effortful. Yeah. Then after that, you move on to, when you understand the skill, you have start performing, and then you know error, and then you know how to fine tune your error, then it will still have to think before you retrieve the skill. Yeah. The brain, when we already know the steps of the skill, but when we come to an associative phase, we still need to think first before only we start the procedure, right? So when it becomes so common, so habitual to us, it becomes very effortless. Yeah. Autonomous, it become more reflex. Yeah. And no conscious retrieval during that time. So and you can see the initial phase, which is we call novice. It will be a try error phase, and erratic. And when we go to associative, when you start knowing how to do the skill, but you are not so used to the skill yet, it will become more fluid with fewer interruption. And finally, when you become the expert, the skill is so autonomous to you, right? So it will be very smooth, accurate, and fast. So we can see, we have to know what is learning curve in terms of our psychomotor skill. Yeah. So a learning curve is actually a plotted graph of performance against experience. Yeah. Okay. You can see here there's few phase of learning curve, which is the B, the C, the D, and the E. Yeah. We look here first. Yeah. So the normal learning curve, it depends on how complicated is the skill. Yeah. So let's say if the skill need continuous, the learning will be slow progress, something like this. If the learning curve, we have a very steep type of learning curve, it will be something like this, you know. So the initial phase will be slow, this type of curve. Then after that, when the error, all that is being starting appreciate, and starting to change the behavior, the performing skill, so the error will be moving on, and very steep up here. And when the learner reach this steep point, then meaning the learner already reached their learning curve, and then it will be plateau, meaning the learning curve is achieved, and the technique is already being grasped by the learner, and all the expertise will be achieved and plateau out. So you can see here as well, there is some, this is we call primary learning curve that we already say just now, but you can see this is a acceptable standard. Yeah. So once the learner reach this point, they should reach this plateau. Okay. All right. So, and it depends on cases that the learner being have performed. And we should understand that sometimes different types of skill have different learning curve, right? The complexity and the demand of the skills is different, right? So you can see here how our learning being evolved. Okay, so you can see here the use of different technology from long time ago until now. Yeah, so before this the learning is using blackboard and chalk, and now is already reached wireless technology and AI. Yeah, so you can see here, so this is the current I mean, before, how we do laparoscopy, you have simulator, right? And then this is the type of simulator we have for laparoscopic simulator. And as well as for microsurgery, we do have a specimen for the trainee to learn and to achieve their milestone, the learning milestone. Yeah, and this is another type of open, how open surgery being performed and being trained. Yeah, this is a laparoscopic way, and now become robotic as well. Yeah, so how are they different between all these tasks, and how are we going to achieve the psychomotor skill? It really depends on the trainee, how training. First thing is the education schedule as well as training, and the second one, you can see here, there's more and more new of it, such as this type of psychomotor VR simulation system that have been invented to reduce the steep learning curve. Yeah, and as well as this type of virtual reality surgery simulator which is invented. It is very good type of skill that we have seen, and it is a computer based interactive type of virtual reality program that can run and use for some of the surgeon, like cataract surgery or that. Yeah, and you can see here the live. Before this, we use live video through YouTube, then the trainees start learning from how people do first, right? And we do have a live surgery workshop, then you can see live how a trained and experienced surgeon perform the psychomotor skill, and you start have the what we saw, visual connection about the skill and how to do it. And as well as cadaveric workshop, which is a very good type of way and methods for the psychomotor skill. And clinical skill lab and simulator, also another type of very useful psychomotor skill learning type of methods. This is another type of laparoscopic simulator. And what is the future of education and training in our surgery? So because of increasing uh, development, and our education in surgery have evolved further because of new type of what we call, we have more things to learn, such as higher technology such as robotic surgery. So what is the next best and possible that tools that we can use for a psychomotor skill training? Yeah? So machine learning and AI have made all the changes or evolve all our psychomotor application training. Yeah, so it become more automated, as well as there is a very complicated and complex schedule assessment as well as feedback type of training system for current for future. Yeah, you can see here AI for surgery have been evolved now. Okay, so it can include and it can help in supervised learning, and as well as semi supervised, and learn the learner actually can learn from demonstration through AI, and also can reinforce learning, and also the finally is meta learning. All this is a future of our education for psychomotor skill training in our surgery. Yeah, it involve pre-op planning, that how AI and machine learning help us to improve our learning skill and perception and planning before we go in for to do a surgery. Yeah, so the AI machine learning actually can take very detailed 3D or view and vision of a patient before surgery. So they can, So the learner as well as the supervisor can plan the surgery even before the surgery started. And the AI and machine learning or the robots actually can help in guiding the learner even before the surgery. So they can train you how to do the surgery particular to that patient. Yeah. Okay. And the intra-op guidance as well. And they might have a lot of feedback session during the surgery that can help and teach the learner and even the experienced surgeon for the possible challenges during the procedure, as well as during the procedure it will be guided by robots as well. Yeah, robotic surgery. So all this is have been start moving on as an application as the new modern era of psychomotor skill education and training in our surgery field. Yeah, surgical field. So with that, I would like to summarize it. Psychomotor skill training has been evolved. Yeah, okay. So the advancement in AI has been transformed to a modern surgery towards more precise, more autonomous intervention for treating both acute and chronic symptom as well as teaching and training as well. So such skills have notably progressed and in intra-op, pre-op as well as surgical surgery during the surgery itself. And as we as a supervisor as well as trainer, we hope this skill can bring more benefit to our trainee in future so that the training will be more smooth, more advanced, as well as the learning curve become less stiff and achievable. Yeah, with that, I would like to thank everybody that joining the talk. Thank you.